I'm Dr. Carey Hemmelgarn. Today we're going to talk about feline infectious diseases.
This program is brought to you by Merck Animal Health.
There are people who love people, and there are those who love animals. Veterinarians. They love animals so much, they dedicate their lives to them. Their beginnings, and sometimes their ends. And while most of us speak just one language, they understand the unspoken language of many. They have to speak dog, and cat, hamster, and horse, parrot, and pet parent, cattle, and pig, and whatever that is. They are there for animals, in good times and emergencies, all while dodging claws and teeth, from dusk till dawn. Then get up and do it all over again. They never fail to rise to the occasion, always looking for new ways to provide the very best care. And since animals don't have the ability to say thank you, we'll do it for them. A heartfelt thank you to all veterinarians for your unconditional commitment to animals. We know it's not always easy, but thank you for giving your unconditional love to the animals we love unconditionally. Sometimes there aren't words. Then again, sometimes you don't need them.
So I'm going to tell you a little bit about myself. I'm Dr. Carey Hemmelgarn. I am a small animal critical care specialist, and I currently work in clinical practice. I started my vet school career at Washington State University, and I furthered my education with a 1-year internship rotating through multiple specialties, followed up by a 3-year residency in emergency and critical care. Currently, my job entails working in the emergency room and seeing triages and managing cases in our intensive care unit. I have a very strong interest in continuing education and advancing the education of our veterinary profession. I'm also the co-founder and CEO of IntensiVets. It's an online training platform for veterinarians and veterinary technicians. Because I love educating people in our veterinary profession, I'm so excited to be here with you guys today. The first feline infectious disease we're going to talk about today is feline infectious peritonitis. This is a viral disease that's caused by strains of coronavirus. There's feline enteric coronavirus, which cats are exposed to very readily in the environment. This lives in the GI tract. The strain usually only causes very mild GI signs and maybe not even noticeable. Most cats will mount an immune response to the enteric coronavirus and develop immunity and pass it. A rare percentage of cats, usually less than 10%, the enteric coronavirus will mutate to infect the white blood cells and then spread throughout the body. This mutation is called the feline infectious peritonitis virus, and it causes a massive and immune inflammatory response around the blood vessels. The clinical signs that we'll see with cats that are affected with FIP are secondary to the immune reaction of the virus. There's 2 main forms that we'll see. The most common form is the wet form, meaning effusive. They normally will develop cavitary effusion, either pleural effusion or ascites. The dry form is less common and a little bit harder to diagnose, but it's categorized as a pyogranulomatous reaction. The clinical signs are based off of the organ systems involved and whether the cat has wet form or dry form, but commonly include lethargy, fever, inappetence. If it's a wet form, then cavitary fluid accumulation, uveitis, and they can develop secondary organ failure. Diagnosis with the wet form is easier, and that can be done based off of PCR on blood, fluid, or tissues. If it's the dry form, it can be a little bit more difficult, but it is something that you can diagnose off of blood samples or FNAs of lymph nodes if they're enlarged. Unfortunately, there's no definitive treatment that's been approved by the FDA for FIP. There is a new novel experimental treatment that has had some varying levels of success in cats, but unfortunately it is not FDA approved, and so it cannot be overtly recommended by veterinarians. But if you do have clients that are very interested in it, it may be something that they want to look into and potentially explore on their own. But again, unfortunately, there's no FDA approved treatments for FIP, and that unfortunately cats with this disease will commonly pass away from this disease.
There is one FIP vaccine that is for intranasal vaccination of healthy cats 16 weeks of age or older as an aid in preventing feline infectious peritonitis caused by feline infectious peritonitis virus.
So that's it for FIP. We're going to move on to feline immunodeficiency virus now. Feline immunodeficiency virus is a virus that affects the immune system in cats. The primary vector for transmission is through bite wounds of other cats. It can take cats years of being seropositive for the virus to develop clinical signs, so it's not an immediate transformation. Positive cats are immunocompromised and at risk for development, unfortunately, of secondary bacterial infections, viral infections, protozoal, fungal, any of those that can act as opportunistic organisms. Clinical signs that we would expect to see for cats that have feline immunodeficiency virus are some of the normal ones we would expect, which are lethargy, fever, inappetence, weight loss, gingivitis, stomatitis, upper respiratory tract infections, diarrhea, and neurologic signs. Diagnosis of FIV is a fairly easy process and can be done easily within your clinic. It's done via an ELISA, or it can be further confirmed with an immunofluorescent antibody, which would be a send-out test. Cats up to 6 months of age can have maternal antibodies creating a false positive, so always remember to check cats if they're not yet at 6 months of age after 6 months to make sure that their status is that they're seropositive or seronegative. Unfortunately, again, there's no treatment that's available for FIV, and the focus is on prevention and supportive care.
There was one FIV vaccine available years ago, but it is no longer marketed.
Supportive care is by treating them with IV fluids, antibiotics to treat for secondary bacterial infections or viral infections to help them through that. And then the goal is to try to keep them as happy for as long as possible with this disease process. So the next virus we're going to talk about is feline leukemia virus. It's contagious via saliva, nasal secretions, urine, feces, and bite wounds between cats. They can be exposed in vivo and be passed on to the kittens. It can also cause them to have an early abortion. It creates a difficulty for cats' immune system and can lead to secondary infections. The most common clinical signs we'll see are lethargy, weight loss, fever, anemia, gingivitis, stomatitis, diarrhea, neurologic signs. Again, it can cause abortions and it can also cause lymphoma as some of the end results of this virus. We can diagnose this in hospital, which makes it very easy to try to get an answer for what's going on with these cats. We can diagnose it with an ELISA and further confirm it with an out-of-hospital immunofluorescent antibody test. So there's no cure for feline leukemia, so we're going to try to focus best on prevention and try to avoid it in our cat populations. So the best way to prevent this is to try to prevent spread, and so to test cats to make sure they're not positive and to try to minimize spread, again, minimize bite wounds, saliva, nasal secretions, anything that's going to prevent cats from spreading amongst themselves. Feline leukemia has been associated with lymphoma and that it's very difficult to treat and has a poor response to chemo, worse prognosis than lymphoma that's not associated with feline leukemia.
According to the AAFP and AHA feline vaccination guidelines, it is considered core for cats up to 1 year of age, then non-core based on lifestyle afterwards.
The mean survival time in cats after diagnosis is less than 2.5 years, and that cats that are feline leukemia positive should not be housed with cats that are feline leukemia negative because they will have the risk of transmitting that virus to another cat. That's everything for feline leukemia. We're going to talk about panleukopenia next. The next virus we're going to talk about is feline panleukopenia. Feline panleukopenia virus is closely related to the canine type 2 parvovirus, so this is going to be very similar as what we talk about in parvovirus. The transmission is from fecal shedding of viral pathogens and then fecal oral transmission. It's very contagious and lasts latent in the environment for long periods of time. This is part of the core vaccine series for cats and is something that we can vaccinate them against. The average incubation time if cats are exposed is about 2 to 7 days from when they're exposed to when they start to show clinical signs. The clinical signs are similar as what we know from canine parvovirus, but we're going to see fever, lethargy, very profound vomiting and diarrhea, inappetence, and unfortunately some cats can develop central nervous system signs. The highest mortality is seen in cats that are less than 5 months of age, but it is something that cats don't necessarily pass away from. We can treat them and we can get them through this. It affects rapidly dividing cells, mainly in the gastrointestinal tract, the bone marrow, and the neurologic system. So we can diagnose panleukopenia in the hospital by looking at clinical signs and if there's a leukopenia present on the CBC. You can also use your canine parvovirus, ELISA, and do a SNAP test. There can be some false negatives associated with that, but it is a very easy test to run in the hospital that gives you a very easy diagnosis of a cat having panleukopenia. The mainstays for treatment are going to be supportive care, IV fluids, antiemetics, antibiotics to prevent secondary bacterial infections and to combat that GI translocation. Nutritional support, again, the sooner we can get a feeding tube in, the sooner we can get food into their gut, the healthier they will start to be. GI motility medications. There is a way to prevent panleukopenia, and that's going to be vaccinate, and to vaccinate our moms and vaccinate our kittens, and to minimize exposure as much as possible. So we're finishing up with panleukopenia, and the next we're going to talk about is our feline respiratory complex. So the next disease we're going to talk about is feline respiratory complex. That's feline viral rhinotracheitis, or feline herpes type 1, and feline calicivirus. The transmissions for these viruses is from oral nasal secretions that can be aerosolized or via fomites. So cats that are drinking from the same bowls, eating from the same bowls, using the same litter boxes, and sneezing and coughing can transmit these viruses to each other. Cats with feline viral rhinotracheitis tend to have fever, lethargy, ocular and nasal discharge, and inappetence. Cats with calicivirus will have similar clinical signs, but also have severe ulcerations in their mouth and could develop pulmonary signs. Some cats have a weird presentation of calicivirus where they're just limping and they have very minimal oral or respiratory signs. Chlamydia and mycoplasma can also be secondary infectious agents that can worsen the clinical signs we see in these cats. The diagnosis is based off of clinical signs, but we can also send out respiratory PCR panels that can further isolate what organisms are causing our clinical signs. The treatment is supportive with IV fluids, antibiotics to help to prevent secondary bacterial infections, anti-nausea medications, nebulization, topical ocular treatments, supplemental oxygen therapy if they need, especially cats that have calicivirus if they're showing pulmonary signs. And in cases with calicivirus, we often need to place feeding tubes so that we can give them their medications and start them on food because they don't want to eat with how bad their ulcerations are in their mouth. And I strongly recommend an esophageal feeding tube be placed and not a nasogastric, just due to the fact that the cats have so much congestion and pain associated in their mouth.
Bordetella bronchoseptica, which is the primary respiratory pathogen in cats, can be transmitted between dogs and cats. There is a feline vaccine available.
The next disease we're going to talk about is dermatophytosis, or ringworm. Ringworm, shockingly, is not secondary to a worm, but instead it's a fungal infection. Cats are infected through contact of other individuals, and there is a higher risk of developing this disease if they're in shelter populations, catteries, or where they're densely packed around other infected individuals. Ringworm is zoonotic, meaning that our veterinary professionals can contract it, and owners can also contract it. Diagnosing this is via fluorescing with a Woods lamp, PCR, or dermatophyte test medium culture, which is the gold standard for diagnosis. Treatment is usually with antifungal shampoos, topical, and antifungals. Environmental decontamination is very important because it can live in the environment, so you need to make sure all their bedding, blankets, towels, any of that is decontaminated because you can continue to reinfect your environment. So the next disease we're going to talk about is heartworm. Heartworm is spread via mosquitoes in endemic areas. Diarrhea immitis is the causative agent. It takes about 6 months to complete a complete lifespan, and therefore you don't need to check kittens for heartworm disease up to 6 months without being started on preventatives. If it's past 6 months or they have not been routinely giving heartworm medications, you should always check them before restarting. Testing in cats can be a little bit difficult compared to in dogs, as their worm burden tends to be very small, and some cats can only have one worm compared to dogs that usually have a lot more. Ideal testing would be checking for an antibody and antigen. Those are both tests that you can send out to commercial laboratories. There's no FDA-approved adulticide treatment in cats, so melarsomin is not approved for them, such as it is in dogs. You can have an echocardiogram to see if there is worms that are present within the cardiac chambers and could potentially discuss surgical removal. Clinical signs that you're looking for in a cat are ones that may mimic cats with asthma. They may also be vague, such as vomiting, lack of appetite, weight loss, and that sadly, unfortunately, the first time we know a cat is positive for heartworm disease is sudden passing away. The best treatment is prevention, and so having any cats that are exposed to mosquitoes, being on monthly preventatives, is our best way to combat this in our cats. We're done talking about heartworm disease. We're going to talk about toxoplasmosis next. The next disease we're going to talk about is toxoplasmosis. Toxoplasmosis is caused by a single cell parasite called Toxoplasma gondii. This is zoonotic, so it is something that unfortunately humans can also be infected with. Cats are the definitive host for Toxoplasma gondii, with transmission in cats mainly via cats eating infected prey or raw meat. They then can shed their oocytes in their feces, and humans then can be the intermediate hosts. Cats with feline leukemia and feline immunodeficiency virus are more likely to develop disease if exposed to compared to cats that are not retrovirus positive. Clinical signs that we would expect for this would be fever, inappetence, lethargy. Some cats can develop respiratory changes, increased respiratory rate, respiratory effort, pneumonia. Some cats can go into liver failure from this, central nervous system signs, and uveitis. The way that we make a diagnosis for this is based off of antibody testing. We're checking for their immunoglobulins G and immunoglobulins M. A high immunoglobulins G in a healthy cat means they were exposed, but they're not actively shedding oocytes. If they have a high immunoglobulin M, that usually means that they have an active infection. Treatment is supportive based on the organ systems involved, and the antibiotic that we normally choose to combat this is clindamycin. Cats that have pulmonary or liver involvements tend to have a poor prognosis, and this can be fatal. The biggest thing is prevention. We want to avoid exposure to infected hosts, and we want to avoid raw meat ingestion, which could predispose cats to developing this. So the next diseases we're going to talk about is feline hemoplasmosis and Bartonellosis. Feline hemoplasmosis is caused by a gram-negative bacteria that feeds on the red blood cells and is from the mycoplasma species. Exact transmission of the mycoplasma hasn't been completely determined, but feline leukemia and feline AIDS cats are most susceptible to this disease. The treatment for this is doxycycline or fluoroquinolones. Feline Bartonellosis is caused by a gram-negative bacteria from the Bartonella family, and this is transmitted mainly via flea bites to cats. Clinical signs with feline Bartonellosis are anemia, uveitis, gingivitis, chronic ocular discharge are what we would most commonly expect. The treatment for feline Bartonellosis is doxycycline, azithromycin, fluoroquinolones, or beta-lactams. Long-term treatment is often needed to clear these infections.
Rabies is a lysovirus that affects the central nervous system of mammals. It's usually transmitted through infected animal bites. The virus starts at the location of the bite and moves through the body along the nerves until it reaches the brain. Once rabies reaches the brain, the affected animal will begin to show symptoms and will usually die within 7 days. Though people may mostly associate rabies with dogs, rabies affects more cats than dogs in the United States. Thanks to vaccines, rabies is also preventable.
So this was a review of feline infectious diseases. Again, I'm Dr. Carey Hemmelgarn. If you'd like to learn more, please join us at @IntensiVets on social media. Please like, share, and comment on this video. Thank you so much for joining us today.